All right, welcome everybody, and this is Councilmember Johnny Khamis with the City of San Jose, and you're tuning in to District 10's Community Connections. My staff, as usual, is standing by here this evening to help with any questions that you might have for our guest today. So if you have questions, if you're on Facebook, put them in the comments area, and if you're on Zoom, put them in the Q&A. So let's get started. I have some announcements, some updates for us this evening. We'll start by the county, San County entering into the orange of the state COVID-19 framework as of October 13th. It was announced, and we have a revised risk reduction order, and that took effect on the October 14th. What that means to all of us is restaurants are able to open to about 25% capacity. According to the state, they can open at 50%, but in the county has limited the order down to 25%. So there's indoor dining and there's movie theaters are allowed to open. And so visit the Santa Clara County's website for a lot more detail on what is allowed to open and what is still, all these restrictions. And in other public safety news, the Santa Clara County Mobile Crisis Response Team launched a new partnership with our SJPD to train officers on mental health crises and how to de-escalate techniques, they're teaching our police officers because our police officers are often responding to respond to calls for mental illness breakdowns and mental health breakdowns, and they often tend to be dangerous and not good for either the officer or the person who's having the breakdown. So I'm so happy that our officers are getting trained, and I hope the county continues to increase the services for mental health. On the city side, we have some announcements. On October 24th, it's National Prescription Drug Take Back Day. And the San Jose Police Department is working with our DEA to provide the public with the opportunity to safely dispose of their unused expired drugs and keep them out of getting in the hands of children and into the wrong hands, quite frankly, and keep them out of their polluting our environment, on our streams, which often happens with expired drugs. So visit www.deatakeback.com for more information, and my staff will put this in the chat section, and we'll be posting that on Facebook as well. Tonight at 7 p.m., immediately after this community connection segment, is going to be the D2 and D10. So District 2 and District 10 are sharing a seminar on the police chief recruitment, and it's a public meeting, and we invite you guys to log in and learn more about our recruitment process and what you'd like to see in our next police chief who's coming to San Jose. So we'll also post that link on the website for all of us to log on to. And for more announcements, and if you haven't read my newsletter, please do. It has great information on all the tax ballot measures. We do our chart every year that we have elections, and this chart is full of information on all the taxes that are on your ballot. So we have created a spreadsheet, and it'll be at www.sjd10.com. That's SJ, the letter D, and then the number 10.com. And you'll see that you can get that the last newsletter, and we're working on the next one. So Community Connections is titled Coping with COVID, and our special guest this evening is Michelle Humke, and she's the new executive director of the Almaden Valley Counseling Services. I've been so happy to have such a great organization in our district. And then I think my staff is going to go into some details describing the Almaden Valley Counseling Services and our special guest, Michelle Humke. So staff, take it away.
Good evening. The Almaden Valley Counseling Service is a community-based nonprofit counseling agency committed to meeting the mental health concerns of all ages. AVCS offers a full range of counseling services which supports and promotes personal growth, positive family relationships, and emotional well-being. AVCS has been serving the mental health needs of the Santa Clara County community for 40 years. More about Michelle Humke. Michelle Humke has been a licensed marriage and family therapist since 1991. She has practiced in San Diego, Los Angeles, Tucson, Chile, and in Chile, South America. For 15 years, she has served in administrative roles in the field of mental health. She comes to Almaden Valley Counseling Service with a breadth of experience and knowledge of all the services offered by AVCS, including school-based services, managing training programs, and serving a diverse population in the clinical counseling setting. She's very excited to join AVCS as the new executive director. Please welcome Michelle Humke, licensed marriage and family therapist. Welcome, Michelle.
And thank you for joining us. Michelle, the Almaden Valley Counseling Services has been around for a long time, but a lot of people don't know what they do. Can you explain a little bit about what they do?
I can. We have a number of services. One of the services is that we do a lot of school-based work. So we are in schools in the San Jose Unified School District. We are in schools in the Oak Grove District, and we are in a couple of the schools of the San Jose Diocese. And we have counselors on site at those programs, except of course now with COVID, everything is done via telehealth. And so we then are available to the students and their families at those particular campuses where we have those contracts. We also have a clinic-based program, and Almaden Valley Counseling Service is in Almaden Valley. And with that service, then we are able to offer counseling for individuals, couples, families, children with family, without family. And we have a wide range of counseling services that we can then offer here at the clinic site. Our services are done on a sliding fee scale basis, which means basically that the amount that you pay is based on your income. So we are a good source for people who don't have insurance, for people who have insurance, but perhaps it's difficult to use because they have a very high deductible or something like that. Or sometimes people have come to us who have insurance and then ask for reimbursement from their insurance afterwards, but I would suggest that you check with your insurance before you do that. Have I answered
Wonderful.
your question?
Yeah, definitely did. So it's been, let me dive right into some of the questions that at least I have. It's been about 7 months since the initial shelter in place was issued. And, I could tell you that as a parent, so my kids are feeling isolated. I know that my son talks about depression quite a bit. And just 2 days ago, KQED came out with a study that showed a 56% increase in suicides in the last 3 years. And, what do you tell parents who are basically teacher plus, quite frankly, psychologist, teacher, and, and at their wits' end because the kids have no other outlet except for the computer?
Well, I am going to be giving some clues to that in the presentation I'll do, but basically I'll sort of jump into that. And one of the things that has often been suggested is that we try to have as normal a routine as possible. And so if you've got kids in the home, then you want to make sure that they're going to bed and getting up at normal times. You want to make sure that they're eating regular meals at normal times, that they're getting exercise, that if they're doing school distance learning, that they've got basic times of the day that they're doing that. All of us have had our lives turned upside down, and so we need to approach normalcy as much as we can. However,
well, those are good words. It sounds like you have a presentation, and it wasn't on my notes here. So why don't we, if your presentation is ready to roll, maybe instead of asking a whole lot of questions that you'll answer through your presentation, let's roll.
Okay, I'm just bringing up your presentation now. Thanks.
Okay. But we might find after the presentation that some of those questions are still going to be, useful. So
And yeah, no, let's roll, and then we'll go from there. And we already have a few items, a few people calling in, so that's good.
Okay.
Great. I'm sorry, it's acting up. Let me get this sorted out.
Yes, the wonders of technology.
All right, we'll try another way. Here we go. Oh, we got it.
There it is.
There it is. All right, go ahead.
Okay, great. It's good to be with you here. And this presentation is going to talk about some basic skills for coping with COVID. And you've all probably heard these things before or read them, but hearing them again helps us to put them into practice a little better. And also, although I'm going to be talking about a number of things, I'm just going to sort of skim the surface. So you may want to ask questions, or you may want to do some of your own research on the internet after this presentation. Okay, next slide, please. Okay, we all are aware of the stress we have with living with COVID. I've listed some of them here. You could probably have a longer list for your own. The isolation of having to work from home, or if we aren't working from home or going into the office, we are not interacting with coworkers the way we normally would. We can't go and join our friends anytime we want. It's a very isolating situation. The financial issues that this has caused. Some people have lost their jobs or have had their hours reduced, either for themselves or for a family member. Some people have lost their businesses. And so this has really created havoc financially. Also, there's the sort of constant underlying worry about, are we going to catch COVID, either ourselves or family members? We all live with the uncertainty about the future. When the heck is this ever going to end? And also, right now, we're in the orange tier. And so our numbers have gone down, but we have seen other places in the country, other places internationally, where their numbers went down, and then there was a resurgence again. And so we really need to be always vigilant for this awful coronavirus. Then that means that we have to keep remembering those protective measures. Hand washing, masks, social distancing, etc., etc., etc. And even this morning, I went to leave the house and had to go back because I'd forgotten my mask. Next slide, please. Okay, so recommendations for coping. Well, you know, we all need to, with or without COVID, use basic self-care. That's just part of dealing with life in a healthy way. And so we always need to try to get sufficient sleep. We always need to eat regular healthy meals. We always need to exercise regularly and take moments in our days when we deep breathe and are present to the moment. We also always need to avoid excessive use of alcohol, drugs, and tobacco. But with COVID, the need for self-care has increased. As I had just said to Johnny, we need to establish as much as possible a normal routine, the getting up and going to bed at regular times, the having special times for work or school, the making sure that we get dressed and not wandering around all the time in our pajamas, even if we don't have to go anywhere. What can we do to have as normal a routine as possible? We also need to maintain our social connections, even though we cannot do it as we have done previously. We need to have phone and video chats. We need to have socially distanced visits when that's possible, preferably outside, so we're not putting anyone at risk, but making sure that the social connections are there. We also need to avoid an excessive focus on the news, because the news of coronavirus can make us more anxious. The news of natural disasters like our wildfires can make us more anxious. And we're right close to an election, and election news can make us more anxious. Now, in a moment, we're going to look at something of a man who really tried to establish as much as possible his previous routine. He went a little bit far with it. He tried to establish at home the same things that he did, it appears, every day when he commuted to work on public transportation that was very crowded, and he had to stand and hold on to make sure he would keep his balance. So please go to the next slide. Now you'll notice he's at home in his bathroom with his coat on for going to work in the winter and amusing himself with his phone, and in his bathroom holding on. You don't have to go that far, but try to establish a normal routine as much as possible. Next slide, please. Okay, so you've heard me say it. You've probably heard others say it. You've probably read it. There are things we can do to help. But just because we know we should do something doesn't mean that we are able to do it or that we do it all the time. And each person is going to react to this virus differently and is going to be able to try and cope differently. One of the things that affects that is risk level for illness. If you or a family member has a high degree of risk, that can affect it. Age can make a difference. Children and teenagers, it can be harder for them because they don't have much life experience to cope with curveballs like this, but also they are at a stage when they're learning how to interact with peers. And this is certainly putting the brakes on that. People who are between 18 and 30 are in the stage of life where they are trying to establish themselves in their career or with a family. And it's certainly much harder to do that now with all the restrictions we face with the coronavirus. People who have really problems with their economic reality, lost a job, lost a business. As a result, they're having trouble putting food on the table. They're having trouble paying their rent or their mortgage. They're having trouble paying their other bills. This really puts that kind of a strain and makes it harder to cope. Also, if people are suffering a lot of exposure due to their job, like they are a frontline healthcare worker, or they are face-to-face with the public because of their job, or they're somewhat close to their coworkers because of what they do, that can make this more stressful. And if someone has suffered prior emotional problems or problems with drugs or alcohol, it makes coping with something more even more difficult. Next slide, please. Another way that we can try to help ourselves cope is to remember that we are all suffering a loss. We suddenly had what we had before ripped away from us. Our normal life is now something very different. And whenever we suffer a loss, we have to grieve it. And so in order to just mention that to you, I'm going to use the 5 stages of grief model that were identified by Elizabeth Kubler-Ross: denial, anger, bargaining, depression, and acceptance. Next slide, please. Okay, denial is the first stage of grief. And it's really helpful at the beginning. We've had a loss, things have really changed, and we're going through shock. We don't know how to deal with it. Denial can help us cope at the beginning because we're just overwhelmed. But the problem is, if we keep using denial, it's like burying our head in the sand. We aren't looking at what we need to look at. We aren't dealing with our new reality. And right now, staying in denial keeps us from using the precautions and the coping tools we need to use. Next slide, please. Another normal way of responding to grief is anger. Someone has taken away from us what was important to us, and anger is a normal response. We might direct it at our family or our friends. We might direct it at our coworkers. We might direct it at the government, who we think hasn't dealt with this the way they should. Or we might have somebody else we direct it at, like this man who looks like he's ready to punch his computer. It's going to affect us, and we're going to have it directed at different places and different people. And how anger affects us depends on a couple of other things. One is if we're male or female, because frequently male children are taught that anger is okay, but sadness is not. And female children are taught that sadness is okay, but anger is not. So for men, it would be easier to be angry when they're suffering grief than to be sad, and harder for women to be angry. As well, our family upbringing affects this. Some families are better at teaching us how to deal with our emotions than others. And so if we've been taught we can deal with the emotions a little bit more easily. If we've been taught to ignore our emotions, it makes it a whole lot harder. And whatever we're doing with our anger, we need to make sure that we are directing it at the virus. That's the culprit here, not all these other possibilities. And we'll need to express it in healthy ways, and I'll talk about that a couple slides from now. Next slide, please. One other part of grief can be bargaining. And with bargaining, it's been so hard to deal with this that we're looking for the magic solution to come out from under it. And you can see here that this man has thought that the magic solution was to hoard enough toilet paper it would keep him from getting COVID. Nope, there is no magic solution that will keep us from that will help us get out of COVID like that. Not that simple. Next slide, please. And we are all familiar with the sadness that comes with grieving. Sadness comes with loss. And again, as I said before, whether we can express our sadness more easily can depend on those two different factors. If we're a woman, it's going to come to us more easily than it is for a man. And if we've learned how to cope with our emotions and express them more easily in our families, it will be easier for us to do right now. But no matter what, we need to discover some healthy ways to express the emotions associated with grief. It might be crying. It might be expressing the emotions by writing or by talking it out with someone. But whether we're writing or talking, we've got to do it with the emotions right there. Because if all we're doing is talking with words, it's not going to help us unless the emotions are expressed. It's feelings, not words, that are going to help. Next slide, please. And what we're all trying to reach is acceptance. The grief process is to lead us to acceptance. And the difficulty is sometimes we can be in denial and say, oh yeah, I know there's nothing I can do to change this, I'm accepting it. But that's a hollow acceptance. It's not true acceptance, because we don't get to acceptance unless we've gone through all the emotions that are part of it. Now, this diagram shows it as a nice linear fashion, but it often doesn't happen that way. We can be in anger and suddenly find we're in sadness. We can have reached acceptance and suddenly find we're back in anger again because we're being invited to get to a deeper level of acceptance. But each time we get to acceptance, it means that we are able to deal with our reality better. We can cope better, and we can problem solve with the new reality we have. Next slide, please. Okay, so even though you've heard about how to cope, even though you've got another new tool now perhaps of grieving with the loss that we're suffering, what if you're not coping? What was it that was said? 56% more. Anyway, the numbers are amazing for the increase in suicide, for the increase in depression, 4-fold depression, anxiety up 3-fold. At least twice as many people are thinking about suicide. and may be attempting it. And 10% are reporting increased use of drugs or alcohol. But I have a feeling it might be even more than that. That's the number that we're willing to admit it. Next slide, please. So, how do you know if your depression has gotten to the point where it's something more serious? Well, there are 9 possible symptoms of depression. I've listed them here, but all you need are 5 to get a diagnosis of depression. And of course, depressed mood, well, duh, of course, that goes with depression. But also people can suffer little interest in their usual activities. And sometimes even things they would enjoy just are not at all interesting to them. They can have a change in eating habits, eating far more than they would or far less than they would, sometimes gaining weight or losing weight. They can have trouble getting to sleep or staying asleep, or sometimes sleeping all the time as a way to avoid life. They can be noticeably restless, kind of jittery, or lethargic, like they're moving through life in slow motion. They can be seriously fatigued. They can have difficulty concentrating or focusing. They can have problems of feeling worthless or guilty. And they can have thoughts of death, even to the point of thinking about suicide. And if you're having serious thoughts of death or suicide, and you don't have a whole lot, the 5 other symptoms, you still ought to think that you might be seriously depressed, because that's a serious symptom of depression. Next slide, please. And what about anxiety? We all live a little underlying anxiety right now, given what we're facing in the middle of a pandemic. But how do you know if it's really serious enough to be an anxiety disorder? Well, first of all, the anxiety and worry has to be uncontrollable. It's just there all the time and you can't get rid of it. And then you need 3 or more of the following 5 possible symptoms. Restlessness, that kind of jitteriness. Difficulty concentrating or focusing. Irritability, snapping at anything. Muscle tension, where you just feel all tense all over. And disturbed sleep, hard to fall asleep or stay asleep. Next slide, please. So, what do you do if you think you might be clinically depressed? If you think you might have an anxiety disorder? If you're willing to admit that you might be using a lot more alcohol or drugs, or if you're having serious thoughts about suicide. Next slide, please. If you are to that point, don't think you're going to work this out with your family or with your friends. If you had a medical issue, you would go to a medical professional. If you have an emotional issue, it's time to take it to a behavioral health professional. Services now are for the most part done by a telehealth. If you've been able to see this community conversation, you know how to access things on the internet. You can do telehealth. And it's a safe way to do these things. It's like they're doing telehealth with medical visits often now too. So if you're insured, go to your insurance website or go to the number on your insurance card to find out who you can see who will be covered by your insurance. If you're not insured, the County Mental Health Services call center operates 24/7. The number is on this slide, and I believe it will be provided for you in the chat. And so you can call that anytime to get referrals. If you're in immediate crisis, you're really thinking of harming yourself or someone else, we need to get you help right away. Call 911. Call the County Suicide and Crisis Hotline, and that number is on the screen. Or you can text to the Suicide and Crisis text line, and that is 741-741, and you can text BAY or RENEW. Those are possible resources. And next slide, please. Johnny already asked a bit about our services, so I've told you about them, but don't forget that Almaden Valley Counseling Service is a resource. We're there to be helpful for you. Our number is on this slide. Our website is on this slide. It's Almaden Valley AV Counseling.org. And it gives me a chance to mention that we were recently given the award of being a top nonprofit 2020 by Open Counseling. And the way we received that award is that people who had our services gave them good reviews about their services with us. So if you choose to come to us, we'll do what you need. Next slide, please. And so for today, please use what I've talked about and whatever the questions are and whatever happens in this continuing conversation so that you won't let COVID conquer you today. Not today, COVID-19. Thanks. End of slide.
Well, thank you for this great presentation. And you know, the nice thing about this is it's going to be on Facebook. And if anybody missed a portion of this, they can go back and help see if they can, you know, ask themselves the diagnosis questions that you posed. And this is, I think it's a great resource. So, but so now let me go to some questions that I received over the internet. My son missed graduation and prom due to the closure. He was planning to start college in the fall, but has deferred it until next year. He's locked up in his room and falling into a depression. He tells me he's fine, but I know he's not. How can I convince him to talk to somebody because he will not open up to me?
Okay, my first suggestion is this: family counseling. Try going to counseling yourself first to talk to someone about how to help your son. Then once you've started it, you have shown him that counseling is not something to be afraid of and you're willing to do it. Model for your son what you're asking your son to do. Then see if you can convince your son to come with you to a session. And since counseling right now is telehealth, your son is going to be able to see that you're doing it because you're going to be there at home doing the telehealth. And so that is my first suggestion. Use those resources, do the family counseling, and then see if you can use that as a way to get him to follow.
Great advice. Great advice. I have another question here, and it says, with the holidays approaching, I'm having major conflict with my husband. He wants to invite family over, and I don't. In addition to the risk of to ourselves, I'm the primary caretaker for my elderly parent. What suggestions do you have? This is creating great tension in our marriage.
Yes, I'm sure it is, and I'm sure you're not the only marriage and family that's going through this.
I could tell you my own family's going through this, so I can't wait to hear the advice.
Well, I'm going to reach for something here in my office. And I'm going to say, I wish I had a magic wand that solved it. I have a magic wand, but it has no power. But I'll give you some ideas. One is, frequently people look at this as an either or. We either have them over or we don't have them over. All right. So what if you look for some other possibilities? Like, can you all eat dinner in your own places, but eat it while you're Zooming? So that you're visiting with each other while you're having the holiday. Another possibility is, you know, it might be cold at that point, so bundle up. Can you go to a park and have socially distant holiday gatherings? Look for some different kinds of ways that we can do this so that we're not gathering with family, but so that we can also do it respecting people's need to not contaminate each other. Because none of us know if we're positive and could give this to somebody else. The only way I had a test once because I could have been exposed to someone, and what I said after that test is, well, I know for the first hour after I had the test, I was not positive. But after that, I had no way of knowing because within an hour, I could have been exposed again. So look for alternatives.
Yeah, very good advice. Still tough though.
Oh, there's no difference. Like, can't we be through with this, please? Yeah.
Yeah, no kidding. So I have another question here. My uncle lives alone and has been in complete isolation since March. He hasn't been to a restaurant or visited with his friends, family, and is extremely paranoid to leave his house. He sometimes takes walks around the park, but I'm afraid once the weather gets chillier, leave at all. How can I get him to leave his house and begin socializing? This cannot be healthy for him.
Okay. One of the things that I would suggest is if you can help him interact with you in a socially distant way. I am hoping that you live geographically close to him. And so that perhaps you can go and say, okay, let's go on a walk together. I'll keep my distance from you, but let's do that. And even when the weather gets cold, see if you can get him to do that. See if you can take out, order food and eat together, but at a picnic table so that there's enough distance between you. See if you can help him to interact in a way that he doesn't feel threatened by the virus. And try doing that to see if you can't help him to connect more often. Also with phone calls, if he doesn't know how to do video chat, that makes that harder, because certainly if you can do it face to face, it's a lot easier. But try doing those kinds of things to invite him in.
Good advice. Good advice. I think we answered the next one. It says, I lost my job and I don't have insurance. I need counseling service, but I can't afford it. It's a catch 22. What I do. I think you answered it, but go ahead.
Okay, I can just emphasize those things again. Again, there are a number of resources with the county. And also, if you've lost your job, you might now qualify for Medi-Cal. So that's something to check on the social services we have. And certainly Medi-Cal has services that are covered by Medi-Cal. But also, you're welcome to come to us. We have a sliding fee scale. We're not free because we do have to pay to keep the lights on. We do have to pay to have the internet. I mean, there are some basic costs to running a business that we cannot do without. And of course, our counselors, we have to make sure that we pay them something. So, but we do have a very low sliding fee scale compared to what people are paying for services in the community.
And you can find out about a lot of the county services by just dialing 211.
Yes, absolutely. 211 is a great resource. And also you can do 211 on the internet and do a website search too.
Great. So let me ask my staff if anybody is online and wants to ask a live question. Is Adrian, is anybody online that wants to ask a live question?
We haven't had anyone who has submitted live questions, but we do have a few questions to ask from the audience, if Michelle would like to answer those. One question we received is, how does the sliding scale work and how actually are prices determined at AVCS?
Okay, the sliding scale, we ask people what is their gross income, either per month or per year. So we ask them that, and then depending on where they fall in various ranges is what we can offer them. Now, as I said, we can't offer this service for free because we have to, meet our basic costs. But it is a low scale. Usually our lowest is 35, but on occasion I've been able to sort of go a little bit below that, but we can't go a whole lot below it because we have to meet our basic costs. But yes, depending on where people fall, that's how we'll figure out what their fee will be.
Great, thank you. Another big question that people had was about telehealth. And the question really was, how does telehealth work and how different is it from normal in-person check-ins, if at all?
Okay, I am going to use an example of, I have both done it as a therapist and I have done it as a participant. I recently moved to San Jose. I had to establish care with a medical provider, and my first appointment with my medical provider was via telehealth. So I've had both experiences. Basically, what happens is you are usually sent a link in some way. If you're able to do it on a computer, you can log in on your computer. If you need to do it on your phone, you can log in on your phone. So you get a link, and usually then you will be waiting on that link until the provider, the therapist, then opens the link for you. And then you will see the provider. Frequently, you also see yourself as you would if you were on a video chat with someone, and you can talk about it. Now, there are some limits to telehealth. One is it's easier to read people's emotional state when we're in the same room with them. So if all we're able to see is this much up, like I have been gesturing with my hand several times, and I'm aware you can't even see my hand. You know, it's not the same, but you can see people's faces. You can see their shoulders. You can get a sense of how they are in the telehealth. And so it really is an effective way of doing this. And actually, 13 years ago, I was part of a study that we did where I was working for using telehealth for psychiatry patients. And so we did that study for 2 years, and we found out that telehealth works very well for psychiatry patients. It works for counseling patients. And there have been lots of studies since then and show that it is a very effective way of providing services. And I have a feeling that even once we don't have to do things via telehealth, people will still be using telehealth on some occasions. It's kind of convenient not to have to get in the car and drive to where you need to go.
It is the wave of the future. Yes.
Yeah, Zoom is not going to go away.
Great, thank you. I have a few more questions, and I will add that usually we have talk about who is asking the questions or have questions asked live, but because the subject is kind of touchy, we're going with anonymous questions this time just to protect privacy. So a question we had was, does AVCS provide service to teens or adults only, or what is the range of services that you offer?
Oh, we provide from very small children to the elderly. No age is excluded. No, we have some, we work with families, we work with couples, we do some play therapy. We do a little bit of everything here. We're a one-stop shop in that way.
Great. And just following up on elder services, one person asked that AVCS used to have elder care services, and will they bring that back?
You know, that's a very good question. I have only been here at AVCS for 2 months now, and so, well, actually a little more than that. So there's a lot I don't know. I know elder services were offered. We do offer counseling for elders. There's no problem with doing that, but I know we used to offer like some case management kinds of services. I don't know what happened, that those are no longer offered, and I haven't had time yet to investigate that. But at some point, I will investigate it and see why it stopped being offered and if there's enough need that we need to go back and start doing that again.
Great. The next question is, why do you think there is stigma around counseling? And is the pandemic helping to lessen or heighten the stigma in any way?
Okay. You know, the stigma has been with us for a long time. We're talking about millennia. There was a lot of misunderstanding of what led people to have emotional health issues. And they thought it was a weakness of character. They thought it was possession by the devil. They would put these people in locked rooms. I mean, when you look back in the centuries, the way that people were treated when they had emotional health issues was horrendous. And it's over the last maybe century and during the last decades that we developed much more of an understanding of this, that sometimes emotional issues are due to things about our body. Like, unfortunately, depression we can have a tendency to be depressed depending on what's in our genes. We can have a tendency to some of the more serious illnesses like bipolar or schizophrenia depending on what's in our genes. But notice I said tendency. We can also do self-protective things so it doesn't happen. So we know now that sometimes our biology and our genes can affect this. We also know that it isn't just a weakness of character. Sometimes our history hasn't taught us how to deal with things. Or sometimes things can happen to us in life and we really just need a little help. It's the same thing as, like, as I said, as a medical problem. Sometimes we need a professional to help us with it. So that helps with the stigma and how it got to be stigmatized. I don't know if the pandemic is reducing that. I know that certainly there has been more of a focus on how the pandemic has increased emotional health problems. And so maybe people are seeing it as more of a normal issue to have emotional health problems when we're all tossed into a difficult situation. I don't know. But that certainly is an interesting thing for someone to study, whether the pandemic has decreased the stigma associated with getting these services.
Yeah. We have another question, which is, what do I do when my longtime friends tell me they can't be my friend anymore because of my political views?
Ooh,
Oh my.
that's a tough one. Yeah.
Well, you know, I think that one of the things that we have to remember is that we are living in a country that is very polarized right now. And so one of the things that we might want to consider is, after we get through the election, will political views be something that are as discussed? I don't know. The other thing is are there enough positive things in the relationship that make the difference in political views unimportant to continue the relationship? And maybe if the political views are making the relationship difficult, maybe that's a clue to sort of put a lid on discussing the political views with that person. Maybe it's not worth it in that relationship to open that as the topic of conversation. Just make sure that you're focusing on other things. I have some relatives, and I won't talk about politics with them because I know it's not a safe topic.
Politics and religion, right?
Yep, and be dangerous topics.
Yeah.
Yeah.
Any more questions, Adrian?
Yeah, we have a few more that we'll go
Oh,
through.
okay. Sorry.
And this was an anecdote we had submitted, who said that we have a senior friend who is among the vulnerable populations and cannot do in-person meetings. And we did a GoFundMe to purchase a laptop for him and to prevent isolation. Is it a good idea to help him find affinity groups based on his interests that are meeting online? Is there a resource for this or just internet search?
Well, you know, that's a very good question. I think affinity groups would be very helpful because certainly the online affinity groups can really help to reduce the isolation. That would have been a good thing for me to mention. So that's a good idea. Now, you might want to look at some ways. Does he need some help with how he manages that? And yes, as Johnny mentioned, 211 is a good resource for looking for affinity groups. You can do it by calling. You can also do 211. I don't remember how you do it here. If it's 211 Santa Clara, or how you
211 is the Santa Clara. It's kind of an all-inclusive phone number.
Okay, but
You can get many
it
services.
on the internet too. You can do a web search with it too. So if you go on the web search, you can also look for affinity groups that way too. So, and also you can do an internet search. You can just put in support groups for elders who have to stay at home, San Jose, you know, or you can, now that we're doing it internet, you can put support groups for elders stuck at home. And you might have support groups with someone in New York City. Who knows? And it can still be helpful.
All right, thank you. I think we'll do one last question, which is about what ABCS does for school-aged children, so for high schoolers, middle schoolers, elementary schoolers even. And the question is, what do you all do? And with that, Do you employ any kind of marketing strategies to get youth to find out about AVCS? Have you considered advertising on social media, et cetera? Or how do you reach out to youth?
Okay, that's a good question. I need to think about that some more. But basically within the schools, we are in the schools who have contracted with us. We are not in all the schools. We have to have a contract with that school. I believe most schools have contracts for these services, and some use ABCS, some use other good agencies that provide those services. Within the schools, it depends on the school, how they market it within the school. They sometimes the academic counselors will do it. Sometimes the principal has other people who do it. It really varies with the school. And we do try to make sure that the parents and the students know about it. We will ask to be involved in parent-teacher meetings, and now, of course, doing that via Zoom. We will ask to be involved in faculty conversations so we can make sure that we do that. We will do individual counseling with the students. We will also do groups with the students, and even you can do groups on telehealth. They work really well. And we also have done some groups for parents, some presentations for parents, and we're offering that a little more now because, of course, parents are wondering, how do they cope with distance learning? How do they help their children with distance learning? How do they help their children with the hybrid models that are starting to surface? Yes, we offer all of those kinds of things. How we make ourselves visible on social media. I know we have had a Facebook page. We need to beef that up again. And I have been using an email contact list to get the word out that way, but we need to do a little bit more of that because we like everyone else, when the shutdown happened, we went through what do we do now? And so things are functioning much better now, and we are trying to make sure that people know we're here and we're an available resource. That's one of the reasons why I'm here tonight.
Great.
Yeah, that's what I was just gonna say. We're happy to help, Michelle, and thank you for being on this evening, and thank you to my staff for all being on this call. Adrian and Amal and Shane are all here helping us get this meeting together. You will definitely see this on my Facebook, and we'll put links to this in our newsletter so that we can spread the word. And welcome to San Jose.
Thank you. Glad to be here.
All right. Well, I'm gonna get back to reminding some people of upcoming events, and we'll call it an evening. So check out our newsletter, and it's actually on my homepage, which you can go on to at d10.com. So www.d10.com. So you could find our latest newsletter and a lot of important information of what's happening in the county and all around us at Orange level and what have you. Join me this Saturday, October 24th at 10 a.m. for a special District 10 Leadership Coalition meeting. Our special guest will be Roberta Moore from the Envision 2040 Task Force to provide updates. We'll have a discussion on the task force and all the proposals that are being discussed citywide. For one of the biggest, most controversial proposals is allowing single family homes to become fourplexes by right. So, demolishing your home and building a fourplex could be in the future of San Jose. So join us for that discussion on Saturday at 10 a.m. Again, thank you for joining us here for Community Connections, and we'll see you next time.